kapag ginawa natin yung will ng Lord, lalo-lalo na ngayong araw nito, expect blessings from the Lord.
Panginoong Jesus, Diyos na may gawa ng langit at lupa. Salamat po.
Pagpapala sa lahat at pamumuhay na tapat na Diyos. Amen! Sa pagpalakpak na malakas.
Bag na alam sa kayuan, siya Gonzales represent the summer capital of the Philippines, TopRank Valley.
Ako si Leonard Gonzales, sa Queen City of the South, TopRank Cebu!
Congratulations to our new Mr. TopRank Radtech, TopRank Cebu, Dr. AJ Rojas.
Congratulations to our Miss TopRank Radtech from
Miss TopRank International Corporate Art Portfolio. Ladies and gentlemen, TopRankers, your new Mr. and Miss TopRank Radtech. Save your eyes from your tears.
The world is full of successful failures. Many of the most people overcome setbacks and disappointments to reach the top. Be tenacious, an old-fashioned alchemist who turned metal into gold. Saturday is a big day. Don't lose your chance. Live that day as if it were your last. Your time is limited. Do not waste it living someone else's life. Know what you want in life. Define your own success and stop at nothing to achieve it. You got a dream, you got to protect it. You want something, go get it, period.
Everybody, what is your bonus?
sa bawat puyat pagod na dinaanan ninyo para makuha yung bawat lisensya nyo. Nagawa natin ipasa ang board exam. Though wala tayong top-notchers, okay lang yun. At least, we fought a good fight of faith. Pag-celebrate lang naman ay hindi naka-rely kung ilan yung pumasa, kung ilan yung nag-top, kundi kung ilan yung gumanda ang buhay at gaganda pa ang buhay dahil sa lisensya natanggap ninyo mula doon sa mga pinaghirapan nyo talaga. Masaya-masaya kami kasi at least alam niyo na mula umpisa hanggang dulo na sinamahan namin kayo.
You are holding on to that dream. You have a choice today to go up or stay down. Now is the time to take the first step to the top. With quality review materials that produce board top-notchers and thousands of board passers across professions.
Today, let's discuss
In dynamic, innovative, and interactive review delivery. Ensuring an excellent, balanced, relevant, and comprehensive review experience. Extending support beyond review and celebrating victories together as one family. What you choose today determines your success, so make that powerful decision.
Welcome to the top.
Choose to be the top with TopRank.
Sobrang laki ng change ko. Simula nung pumasok ako hanggang nakagraduate ako from TopRank Review Center. One of the best sila sa buong Pilipinas. Mga staff, sobrang accommodating. Talagang din nila tinitipid yung mga reviewees nila sa mga kailangan para matuto. Sobrang lively ng environment, very conducive for learning. Ang daming natututunang knowledge na bago na hindi mo narinig nung college, na bago talaga sa pandinig mo, sa kanila mo matutunan kasi talagang nagre-research yung mga lecturers from TopRank para maibigay yung mga kailangan talaga ng mga students. So, after nung exam, confident ako na RRT na ako, pero hindi ko in-expect na makukuha ko yung 10th place. Nakuha ko tong place na to dahil sa TopRank.
Honestly po, hindi po ako one of the best students in our batch. Susunod po, hindi po talaga ako masipag na tao. Kinailangan ko po talaga mag-review center. TopRank is one of the best talaga na review center. Kasi kumpleto, isang malaking part po talaga ng success tong review center na to kasi pinush po talaga nila kami sa pinaka-limit namin. Minotivate nila kami, tinuro talaga nila lahat. Yung mga staff din po, sobrang friendly nila, approachable, and then yung mga lecturers, the best po talaga sila. Kasi kung san-san pa po sila galing, kahit pagod sila, magtuturo po at magtuturo yan kahit hanggang 9 p.m. nagtuturo po sila, tapos galing pa po silang biyahe, ganun. Sobrang sulit po talaga sa TopRank.
TopRank is actually a good training center for us for taking the Radiologic Board Exam. I actually tried to study by myself, but since they gave me sample of review material and I was challenged by those, so I tried to enroll then. I enjoyed enrolling in TopRank actually, since they taught me a lot. Actually, the best thing about TopRank is that it doesn't bind you with the four corners of the room. They try to embody you with the proper mindset in what's actually worth reviewing for. Are you trying to review for yourself or for the board exam? And they're trying to incorporate it with the faith, trying to make sure na naka-center ka pa rin kung what really matters. And it's not just about passing the board exam, but you have to have the professional mindset, and of course, everything is centered to God.
Natulungan kami noon ng TopRank dahil sila mismo yung nag-adjust ng schedule nila, binigyan nila kami ng magandang schedule para kung ano yung naturo sa ibang block, madaanan din namin. Kahit 2 months lang na pumasok sa TopRank, naging family na yung touring nila sa amin kasi nag-a-ask sila kung okay pa kami. And lagi nilang tinatanong kung kaya pa namin para maging best kami sa sarili namin. Napili ko na mag-review pa rin sa TopRank kahit may mga available pa na ibang review centers or meron namang mga resources. Kasi sa review, parang kailangan mo is yung pati magmamotivate sa'yo, hindi lang magtuturo, pati yung sasamahan ka talaga along your journey para sa board exam na tatahakin mo.
our ever-loving Father, the core of every reason, the source of truth. You who made the earth and the heavens are the ultimate goal of every knowledge seekers, the infinite wisdom, the cause of all that is good. We are truly grateful for this opportunity to gather together as a community despite the challenges we face each day. Yet you remained and gave us strength to carry on the responsibilities of bearing intelligence and using them for better purposes. We now humbly ask you to join us in our endeavor to explore the wonders of life in the world for knowledge's sake, that in whatever we learn today, we become more grounded to you, who is truth, who is love. We pray that you bless our speakers, the fount of your infinite knowledge, that they can share something worthwhile despite the limited time we have. They can channel all they know and share to us the beauty and truth of living as your child. We pray that you guide our participants, the seekers of your boundless knowledge, that they may continue to persevere in the search and be deemed worthy to share what they learn from today's session. Sanctify us, O Lord, not because we are worthy of it, but because we believe in your love and mercy, that at the end of the day, we can take home something that's amazing and meaningful. This we ask and pray through Christ our Lord. Amen.
Mga kababayan, ang pambansang awit ng Pilipinas.
Kayang magiliw, telas ng sinakanan, alam ng puso, sa titik mo'y buhay. Lupang hinirang, tuyag ka ng magiting, sa manlulupin, di ka pasisingil, sa nagagang tutok sa simoy at sa langit mong pagaw, ay hinatang tula, kawin sa pagkayang minamahal. Ang isang ng matawad mo'y tagumpay na naghihingi, ang bituin at araw niya kailan ang may di magdidinig. Luman ang araw ng walhagin pagsinta, buhay langit sa piling mo. Ang inigaya ng pagkay mga amin, ang mamatay ng dahil sa'yo.
Of different schools we start, with a single name in our part. The clash of battle is sweet to hear. Right now and the victory is near. Excellence is our only standard to outshine the rest. With a great mind and compassionate heart. Our home, the trained us to be the best we can be. All that we learned at TopRank Review Academy. We shout with pride and heads up high as victors our dreams shall soar to the sky. The trained us to be the best we can be. Soar to the sky. We learn that you want the TopRank Review Academy. Soar to the sky.
Good afternoon, top rankers, guests, deans, coordinators, and everyone here on Zoom and Facebook Live. My name is Caroline Pelias, and I will be your host for today's event. So today we will be having our Bayanihan Review Assistance Program for Radtech, wherein we will be giving out free lecture series from July 7th until the 11th from 1 to 3 p.m. for our TopRank Radtech free lecture series. We will be having Human Anatomy on July 7 by Professor Vince Neil Rafael Suclad, Rad Positioning on July 8th by Sir Leonard Anthony Gonzales, Rad Physics on July 9 by Professor Mark Jason Gutierrez, Rad Sciences on July 10 by Professor Adrian Luigi Morte, and last but not the least, for Rad Technique on July 11th will be Professor Maria Isabel Ramirez. So for the benefit of those who doesn't know who TopRank Review Academy is yet, let me introduce our brief company profile. So TopRank has been established in 2013, and right now we're already considered as one of the biggest national review centers here in the country. We currently have 20 local branches and 4 international branches. So for our local branches, let's start with our Manila main office. We are located at the 5th floor of the Don Lorenzo building, right in front of PRC in Moraita, Manila. And we also have branches in Quezon City, Marikina, and Caloocan. For provincial branches, we have branches in Dawag, Baguio, Dagupan, Nueva Vizcaya, Tuguegarao, Bataan, Bicol, in Legazpi, and Naga, Cebu, Iloilo, Tacloban, Calbayog, Davao, Bacolod, Zamboanga, up until Coronadal, South Cotabato. And for our international branches, we are located in the Republic of Indonesia, both in Jakarta and in Bandung in Indonesia. So what we basically do there is provide them international exam review, as well as trainings and seminars for their healthcare workers to be more globally competitive. And you know what? Amongst all the other review centers here in the country, we're the only one who was invited at the 70th anniversary of diplomatic relations of Indonesia and the Philippines. And this happened prior to the pandemic, before the lockdown last year. We also have branches in Dubai and in Abu Dhabi in the United Arab Emirates. So what we do there is provide them international exam review, as well as IELTS and OET review. So for our track record, we don't only offer Radtech, but we also offer dentistry. Our top one came from Centro Escolar University in Manila. We also offer licensure examination for teachers. Our top 2 came from UP Manila. We also offer psychometrician review and criminology. Our top 1 came from Universidad de Zamboanga. And of course, we have Radtech, which is this is the most recent result that was just announced a few weeks ago. So we got the top 1 spot, 3 top 3s, 1 top 6, and 1 top 10. And our top 1 came from St. Louis University in Baguio, as well as our former top 1 for Radtech also came from SLU in Baguio City. This is our Hall of Fame for our Radtech review. And of course, we also have respiratory therapy. Here are our top-notchers, and these 4 students are also products of our online interactive review for this year. We also offer midwifery and of course nursing. Our top 1 spot, we got the top 1 spot starting 2017, 2018, and 2019. And of course, for this year's MedTech review, these are also products of our online interactive review. So as I have mentioned, it doesn't really matter what platform we are using for our preparation for the board exam, because what's most important is your determination and your perseverance to really succeed for you to achieve success. And because of our track record, we are now multi-awarded as the best national review center here in the country by multiple award-giving bodies, such as the Golden Globe, Best Choice, Q Asia, Global Awards, and Global Excellence Awards. So for our review proper, our review will start on August 31 for the December 2021 Radiologic and X-Ray Technologists review. For more information, and if you are already interested to enroll in our program, please do send us a message through our Facebook fan page. It's TopRank Review Academy on Facebook. So let us now all welcome our guest speaker for today. Thank you.
Hello, good afternoon guys. Maraming salamat po kay Ma'am Vic for giving this Zoom link for us to conduct a simple but very effective free lecture for those aspiring Radtech students who want to take the board exam this coming December. Okay, now for those who want to know me, my name is Leonard Anthony Gonzales. So everyone can call me Sir LA na lang. Okay, I am a registered radiologic technologist and passed the board exam last 2017. Okay, and I am currently working at National Kidney and Transplant Institute as a X-ray technologist, as well as I also handles some of interventional procedures in cath lab and special procedures, as well as we're also well equipped sa operating rooms using CR machines and other portable and mobile machines. Okay, so for today's lecture or for this afternoon's lecture, I would like to discuss some of the basic positioning technique which might be asked sa inyong board exam this coming December. So namili ako ng lecture wherein mas makakakope ang estudyante. So yung lecture na pinili ko or yung topic na pinili ko is yung feel ko na madaming nalilito. Okay, so let me present to you my slide. Okay, everyone, pa-unmute naman po ako. Kita po ba ang PowerPoint ko? Kita po ba? Yes, of course. Okay. So for today's lecture, magdi-discuss ako about rules of oblique. So bakit ito ang napili kong i-discuss? So as I observe in the past years na nagtuturo ako, dito madalas na nadadali ang estudyante. Okay, nalilito sila kung ano ba dapat ang makita pag ganitong obliquity. Nalilito sila kung ano ang mas demonstrated for this kind of position. So for today's lecture, pasisimplihin natin or i-deliver natin siya in a way na maiintindihan nyo ang rules of oblique sa topic ng radiographic positioning. Okay? Okay, this is the outline of my lecture. So I will discuss the rules of oblique of your chest X-ray, ribs, cervical X-ray, thoracic X-ray, and lumbar X-ray. Guys, these are some of the topics na naitatanong sa board exam. So, kung hindi mo gamay ang rules of oblique, so medyo mahihirapan ka. So, para sa lecture na to, isi-simplify natin in a way na mas madali mo siya maaalala kapag na-encounter mo na siya sa board exam. Okay? Tandaan, we do not study hard, but we study smart. Okay? So kung kaya mong pasimplihin mas in a way na mas maalala mo siya, mas better po 'yan. Okay? So let's start. So since the lecture na ni Sir Socled kahapon, some of the body terminologies, anatomical terminologies, which is a bread and butter of radiologic technologies, discuss ko lang yung ibang anatomic movement na kailangan po natin when it comes to radiographic positioning. Okay, let's start with the abduct or abduction and adduct and adduction. When you say abduct or abduction, you're trying to move the anatomy away from the central line. Okay, most common to ginagawa sa extremities. Okay, when you move the extremity away from the midline, tinatawag siyang abduction. Okay, abduction. Ito you're trying to move the anatomy away from the midline, tatawagin mo siyang abduct or abduction. Kapag sinabi namang adduction or adduct, okay, you are trying to move this anatomy towards the central line. Okay, abduct, adduct. Okay, next, extension and flexion. When you say extension, this involves the joint of the body, okay? Specifically elbow, knee, so on and so forth. When you say extension, you are trying to increase the angle of the joint or extending the extremities. Ito ha, when you say extension, you are trying to increase the angle of the joint. Now, if you wanted to decrease the angle of the joint or the act of bending, it is called your flexion. Tinatawag po siyang flexion. You do have your extension, you do have your flexion. Okay, nakakasunod po ba mga Radtechs po? Nakakasunod po ba?
Yes, sir.
Okay, yes, sir. Okay.
Yes, sir.
Habang tinutuloy natin yung lecture, at some point of this lecture, magtatanong-tanong ako. So please please unmute your mic for me to hear your answers with those kind of questions. So this way malalaman ko kung may nalilito pa ba or hindi. Okay? Moving on. Hyperextension, hyperflexion. When you say hyperextension, you are trying to increase the angle of the joint beyond its normal limit. So most commonly ginagawa to sa leeg, hyperextension. So kabaligtaran niya naman si hyperflexion. This hyperextension and hyperflexion is usually done in a lateral view of your cervical, wherein the functional studies of your cervical spine is observed with this kind of examinations. Okay, when you say evert or eversion and inversion, okay, ginagamit naman tong term na to sa foot ng pasyente. Okay, when you say eversion, you're trying to move the lateral margin of the foot outward. When you say inversion or invert, you are trying to move the medial outline of the foot inward or medially. Okay, pronate or pronation, and supinate, supination. Okay. Now, kapag sinabing supinate or pronate, it does not involve the palm of the hand. It involves the movement of your forearm. Ulitin ko ha, dito nalilitom. Okay? Kapag sinabing pronate or supinate, it does not signifies na ang movement ay nasa palm. Okay? It just says na ang movement ay nasa forearm. Okay? Now, kapag sinabing pronation, this one, number 1. Okay? You are trying to rotate the forearm of the patient wherein the palm of the hand faces downward. Ulitin ko ha. Ang nagmo-move sa pronation is not the palm itself. It's the forearm. Wherein when you rotate the forearm, okay, the effect must be the palm of the hand must faces downward. Pronation. Kabaliktaran niya is supination or supinate. When you say supination or supinate, you are trying to rotate the forearm, okay, laterally or medially, wherein the palm of the hand faces upward. Okay, ulitin ko ha. When you try to rotate the forearm, okay, as if the palm of the hand faces upward, okay, you call it supination or supinate. So, pronate, supinate. Pronate, supinate. Wag na wag ho kayong gagamit ng term na supine and prone kapag kamay and forearm pinag-uusapan natin. Okay? When you use prone, ang dinidescribe natin dito is the position of the patient. Okay? When you say supine, you are also describing the position of the patient. Okay? So hindi mo pwedeng gamitin ng term na prone and supine sa kamay. Okay? Next. Okay, rotation. When you say rotation, you are trying to move towards the lateral side or medial side, right or left. These are most commonly used sa obliquity. Okay, you are trying to rotate towards the affected side, towards the unaffected side. Sa extremities, ang correct term na ginagamit natin dito is you're trying to use the rotation in a manner kung saan nagro-rotate yung anatomy. For example, okay? Kapag nagposisyon ka ng pelvis, okay? 'Di ba? Part ng positioning ng pelvis, AP pelvis is you will do an internal rotation or medial rotation of the foot. Okay? So, hindi lang pwedeng rotation ang gagamitin mo. I-describe mo din yung manner ng pag-rotate ng extremities wherein it rotated medially or internally. Okay? Circumduction. When you say circumduction, guys, okay, you are saying that we are forming a circular motion within the joint. Specifically, what kind of joint? a ball and socket joint. Okay? Circumduction. When you say tilt, okay, you're trying to skip or tip the central axis of the anatomy of interest. Okay? This kind of movement is most commonly done sa skull, wherein we do a tangential projection. Deviation. Deviation is a movement wherein the standard course, you are trying to move away from its standard course. Ginagamit tong word na to usually sa radial deviation and ulnar deviation ng inyong wrist joint. Okay. Okay, moving on. So kapag sinabing projection and position, magkaiba to guys. First, let us define projection and position. Okay, when you say projection, guys, it describes the path of the central ray, as it exits the X-ray tube and goes through the patient to the IR. Most projections are defined as the entrance and exit point of the body and are based on the anatomic position. For example, okay, unang tumama, okay, nakatayo ako, nasa harap ko ang tubo or ang X-ray tube, nasa likod ko ang IR or ang inyong image receptor or ang inyong plaka. Okay? AP projection. Unang tatama ang inyong central ray anteriorly, lalabas sa posterior. Antero-posterior projection. AP projection. So kapag gumamit ka naman ng PA projection ng chest, okay, nakatalikod ng pasyente, okay, de-describe mo ulit. Saan unang tatama ang central ray? Posteriorly. Lalabas anteriorly. So, the correct term to be used for this kind of examination is PA projection or postero-anterior projection. Okay. As per definition, projections can also be defined by relationship formed between the central ray and the body part as the central ray passes through the entire body of the body part. Dito na papasok yung term na tangential. Tangential lang ba? Meron pa. Nandyan din yung axial. Okay. When you say tangential projection, you are trying to direct the central ray in the curved outer surface of this anatomy. Okay? Most commonly used ang tangential projection for those anatomy na malapit sa surface. For example, sesamoid bone sa inyong foot. Ano pa? Carpal tunnel, nasa surface yan. Carpal bridge, nasa surface yan. Meron mga tangential projection yan. Ano pa? Patella. Okay? Patella, madami tayo examinations or tangential projections na ginagamit sa patella, especially that the patella is placed near the surface of the body. So, tangential. Okay? Now, when you say axial, okay, gumagamit tayo dito ng more than 10 degrees cephalad angulation. Kasi most commonly used na central ray angulation, kadalasan is perpendicular. But there are some instances na gumagamit tayo ng axial projection. Sir, ano ba pinagkaiba ng AP projection sa AP axial projection? Ginamitan ng term na axial. Okay. Pag ginamit yung term na axial, ibig sabihin gumamit ka ng central ray na more than 10 degrees, either cephalad or caudal. Now, sir, anong purpose ng axial projection? Gumagamit tayo ng additional central ray angulation for us to what? Avoid superimposition or to displace those anatomy that provide superimposition. Okay? Para ma-avoid mo ang superimposition. That's the main purpose of your axial projection. Okay. Sir, ano pinagkaiba ngayon ng projection sa position? Okay? Delete muna natin yung mga sulat. Okay. When you say position, the term position is used in two ways in radiology. One way is it identifies the overall posture of the patient or the general body position. Now, the other use of this position refers to the specific placement of the body part in relation to the radiographic table or IR during imaging. Okay, dito tayo sa first definition. Okay, sinabi dito that it identifies the overall posture. Either naka-upright ang pasyente or naka-recumbent ang pasyente. That's the position wherein you're trying to describe the overall posture of the patient. Nakakatayo ba yan or hindi kayang tumayo or nakaupo or nakahiga? Ganon. Okay. Now, the other position is the general body position. Dito na papasok yung mga lithotomy position, Sims position, ano pa ba? Yan. Sims position, lithotomy position, and lordotic position, so on and so forth. The other use of position refers to specific placement of the body part in relation to the radiographic table or IR during the imaging. Diyan na papasok ang RAO, ano pa? LAO, ano pa? LPO, ano pa? RPO. Sir, ano tong mga position na to? RPO, sorry. Okay. When you say RAO, LAO, okay, you're trying to describe the patient in a PA oblique projection. RAO position, LAO position. Kapag sinabing RAO, okay, naka-oblique ang pasyente, right and anterior ang mas malapit sa IR. Kapag LAO, left and anterior, mas malapit sa inyong IR. Kapag sinabing LPO, left and posterior naman ang mas malapit sa inyong image receptor. Kapag RPO, right and posterior ang mas malapit sa IR. So you're trying to describe the relationship of the body part in relation saan? Sa radiographic table or IR. Later on, magbibigay ako ng illustration for you to understand. Okay, chest radiography. Okay. Let's start ha. Mag-start na tayo ng review proper. Okay. The chest radiography or chest X-ray is the most commonly performed diagnostic X-ray examination. So sinabi natin that this is the most commonly performed, but then this type of examination provides the greatest number of repeat examination. Tanda na, chest X-ray na lang yan. Okay, but then kahit na chest X-ray, ang isa sa pinaka-common na examination na ginagawa ng Radtech, yan ang isa sa pinaka number 1 source of repeat examination. Okay, so madaming factors yan. Pwedeng technical, pwedeng exposure factor, pwedeng body positioning or patient positioning, so on and so forth. Okay, chest X-ray makes images of the heart, lungs, airways, blood vessels, and the bones of the spine and chest. It is used to diagnose conditions affecting the chest, incontents, and nearby structures. So these are the most commonly routines na ginagawa natin. PA projection, number 1 yan, PA. Okay, kung hindi kaya ng PA, ano? AP projection. Okay, ano pa? Under your AP projection, there are one type of position na ginagawa sa AP projection, specifically the apical lordotic view or Lindblom method. So for this procedure, I explain to later on. Another one is your lateral projection. So since these are the routine examination and I wanted to focus on the rules of oblique, magpo-focus tayo sa AP oblique projection and PA oblique projection later on. But then, pahapyawan natin tong tatlong to. Okay, let's start. PA versus AP projection. What are the advantages and disadvantages? Okay, escape ko muna to ha. Okay, kita pa rin po ba yung PowerPoint ko, guys? Kita po?
Yes, sir.
Yes, sir. Okay,
Yes, sir.
Sige. PA projection and AP projection are most commonly employed sa institution, kanya-kanyang institution, pwedeng PA and AP. But then, as much as possible, gusto natin na PA projection ang gusto natin. Okay? But then, there are some instances na hindi kaya, AP ang ginagawa. So, what are the advantages? Unahin natin si AP. Okay? Si AP, bakit ba siya ang preferred position in some cases? These are better for pediatric imaging. Number 1 yan ha, better for pediatric imaging. Okay, ano pa? These are the routine of choice for non-ambulatory patients. Tama naman, di ba? For example, intubated ang pasyente mo. Okay, obviously, non-ambulatory patient, ipi-PA mo pa ba yan? No. So, ang routine choice mo dito is your AP projection. Now, bakit ko sinabi na ang PA projection is one of the, it's a better examination in comparison sa AP projection. Ano po ba ang advantages ng PA projection? One of the advantages is what? It provides 10 posterior ribs. Number 1 yan. Sir, ano ngayon kung makakita ako ng 10 posterior ribs? Okay? Kapag nakakita ka kasi ng 10 posterior ribs sa chest PA, ibig sabihin nakapagbigay ka ng correct breathing instruction sa pasyente. Ano po ba ang correct breathing instruction sa pasyente? Anyone? Pa-unmute nga po.
Inhale and exhale, sir.
Inhale and exhale po ba? Okay. Anyone? Second full inhalation. Gagawin mo ang exposure sa second full inhalation. Okay, guys, wag plastic. Nakaka-encounter ako ng mga interns before na isang beses lang magbigay ng instruction. Okay. So ang ginagawa, hinga ng malalim, pigil, expose. Tama? Ganun naman talaga ginagawa nung iba. Okay? But then, board exam ang pinag-uusapan natin. So dapat theoretical ang approach. The correct way is to do a second full inhalation or instruct the patient to do a second full inhalation. Sir, bakit po? Okay? Now, bakit dalawang beses? The first inhalation will serve as a warm up for your patient. Okay? Warm up for your patient. Bakit? Ma'am, hinga po ng malalim. Labas ang hangin. Okay? Pag sinabi mo ng hinga ng mas malalim, you are going to give the patient an instruction na mas mag-i-inhale pa siya ng mas madaming hangin. This way, mas mag-expand ang lungs at makakakita ka lalo ng 10 posterior ribs. Okay? Your 10 posterior ribs serves as an evidence na nakapagbigay ka ng correct breathing instruction sa pasyente. Number 2, advantages. Scapula, wing out. Okay? Scapula, wing out. Ibig sabihin, there were no superimposition of your scapula within the lung field view. Okay? The field of view of your lungs. Okay? Sa AP po kasi, as you could observe here, ipa-point out ko ng pen. Okay, sa AP projection, tingnan nyo ito. This is the scapula of the patient. Sa kabila naman, this one. Wherein you do have a superimposition of your scapula sa lung field niyo, lateral aspect ng inyong lungs. So pag PA projection po kasi, okay, anong ginagawa natin? You're placing the hand of the patient at the side of the patient, moving the shoulders anteriorly to wing out the scapula. This way, you could avoid superimposition of your scapula sa inyong lung field. Now, hindi ba nagagawa ito sa AP? Kadalasan hindi. Hindi pa. Bihira ako maka-encounter na naka-wing out yung scapula kapag AP. Lalo-lalo na kung non-ambulatory patient. Nagagawa mo lang yan sa PA projection. Okay? Okay, balikan ko ba? Ano pa ang advantages ng PA projection? Less magnified heart. Number 3, advantages. Okay? Bakit less magnified heart? Tandaan, ang heart ng pasyente is situated more anteriorly. Kung gagamit ka ng AP projection, you are increasing the object to image receptor distance. Meaning, additional OID will increase the magnification. Now, to compensate with this kind of examination, baliktarin mo yung pasyente, do a PA projection wherein inalalapit mo yung anatomy sa inyong image receptor. Since mas malapit ang heart sa inyong image receptor, it will be projected less magnified compared to your AP projection. So, less magnified heart. Another advantage is what? It is better for your air fluid level. Tama, di ba? Ang PA projection, hindi mo naman yan ginagawa na nakadapa eh. Never pa ako naka-encounter na nakadapa ang pasyente for your PA projection. Madalas yan, PA projection na naka-upright ang pasyente. Since naka-upright ang pasyente, okay, this is very useful examination for air in demonstrating air fluid level. So, pansin nyo, kapag nag-rule out tayo ng pleural effusion, intraperitoneal air, kailangan ang pasyente ay nakatayo. So the best examination would be PA projection. Next, Apicolordotic view. Apicolordotic view is a frontal projection of your apices. Sa PA projection po kasi, there are times na nagsusuperimpose ang inyong medial end of clavicle saan? Sa inyong apices. So papaano kung kung ang pasyente is merong suspected pulmonary tuberculosis, PTB. Okay? So one of the useful examinations is apicolordotic view, wherein the patient is positioned in a lordotic position, wherein the patient leans backward, and you will demonstrate the apices of the patient beneath or below the clavicle. Now, lateral projection. Sa lateral projection naman, it is in an orthodontal view of your PA or AP view, wherein it is a very useful examination for localization. Okay, this is how you position the apicolordotic. This is how you position the lateral position. Okay, sa lateral projection naman guys, okay, ginagamit to usually to localize the metastatic lesion or tumor or lesion sa inyong lungs. Okay, for example, sa PA projection, nakita mo sa right lung na meron tong tumor. So obviously, gagawan to ng lateral projection for you to demonstrate kung more anterior ba ang inyong mass or more posterior. So main function of your lateral projection is for foreign body localization and localization of your tumor masses. Lateral projection. Okay, now, question. Tinatanong ko to madalas. Bakit kapag pedya, ginagamitan madalas ng lateral projection? The main answer is because of its thymus gland. Kapag pediatric patient kasi, lalo-lalo na yung mga baby, required kang kumuha ng lateral image dahil there are some instances na nagkakaroon ng thymic enlargement ng pasyente. Kitang-kita po ang thymus gland kapag lateral projection for pediatric patient. That's why kapag pedya, baby up to 12 years old, nire-require po ito na kuhanan ng lateral image. Now, bakit naman kapag adult, hindi na nire-require ng lateral image? Habang tumatanda po kasi ang baby or ang isang pediatric patient, unti-unti po yang lumiliit. Ang thymus gland, unti-unti yan lumiliit. Until such time na kapag naging adult na ang pasyente, nadadaganan or nasusuperimpose yan ng great vessels of your mediastinum. That's why hindi mo na nakikita ang thymus gland sa lateral projection unless merong cases ng adult na merong enlargement of your thymus gland. Okay? Naintindihan po ba?
Yes, sir.
May tanong po ba so far, top rankers?
No, sir.
No, sir. Ang hinhin naman na sagot na yan. No, sir. Okay, let's move on. So, eto na. This is your projection versus position. In an AP oblique projection, PA oblique projection of your chest, ano ang mga positions na ginagamit? Kapag AP oblique projection, guys, wag malilito ha. Kapag AP oblique projection, tatawagin mo yang RPO position, LPO position. Okay, for example, this one, RPO position. The right side of the patient is closer to the IR. The posterior aspect is closer to the IR. So, naka-oblique ang pasyente, tatawagin mo siyang right posterior oblique position na AP oblique projection. Ganon din sa LPO. Left ang mas malapit sa IR, posterior ang mas malapit sa IR, naka-oblique ang pasyente, left posterior oblique position. Okay? Consider siya as AP oblique projection. Daan na, ulitin ko ha. AP oblique projection, anong position to? RPO, LPO. Kabaliktaran ngayon ito ng PA oblique projection, guys. When you say PA oblique projection, you are trying to use an RAO position and LAO position. Ganito. Kapag right anterior oblique, right ang malapit sa IR, anterior ang malapit sa IR, naka-oblique ang pasyente, right anterior oblique position, which is considered as a PA oblique projection. Okay. Sa left anterior oblique naman, LAO position. Left ang malapit sa IR, anterior ang mas malapit sa IR, naka-oblique ang pasyente, you call it a left anterior oblique position, na isang PA oblique projection. Naintindihan po ba, Radtech?
Yes, sir. Lahat po sila, sir, 45 degree.
Yes, sir.
No, not necessarily. 45 degrees lang ang ginamit ko, guys. Pero pwedeng kahit anong degrees yan. Basta't hindi aabot ng 90 degrees. Kasi pag umabot ng 90 degrees yan, obviously, lateral na yon. Okay? Naintindihan po ba? Okay? Sige.
Thank you, sir.
Yes, sir.
Okay, let's start with your AP oblique projection, RPO position or LPO position ng inyong chest. Okay. When you position the patient or chest of the patient, you position it at 45 degrees body rotation. Central ray is perpendicular to the center of the IR at the level of your 7th thoracic vertebrae. Kapag AP oblique projection, 3 inches below the jugular notch ang inyong reference point. For this kind of examination, remember, the side of interest here, okay, the side of interest here is the one closer to the IR. So, sa chest, guys, sa chest, kapag RPO, LPO ang pinag-uusapan natin, you're trying to demonstrate the side of the lungs closer to the IR. Sir, anong ibig sabihin nun? Tingin sa akin. Okay. Stop sharing muna tayo. Okay, guys, tingin sa akin ha. Sabi ko ulit kanina, kapag RPO, LPO, you're trying to demonstrate what? The view of the lungs or the lung field closer to the IR. So kung RPO ang position ko, RPO ako. Ano ang dinedemonstrate ko? Mas malapit daw dapat. So kung naka-RPO ako, right ang mas malapit sa IR, ibig sabihin, right side of the lungs ang dinedemonstrate sa RPO. Yun ang malapit eh. Yun ang sabi sa rule. Okay? Now, kung LPO naman, LPO, tingin sa camera guys, tingin sa camera. Kapag LPO ang pinag-uusapan, ang sabi natin sa rules of oblique, LPO position, you will demonstrate the anatomic interest closer to the IR. So kung LPO, left ang mas malapit sa IR, left ang demonstrated. Naintindihan po ba?
Yes, sir.
Yes, sir.
Naintindihan
Yes,
po ba?
po, sir.
Tasan ng
Yes,
energy
sir.
guys para
Yes,
pagdating
sir.
sa December.
Yes po.
Papasa na
Yes,
sa
sir.
work. Okay,
Yes,
very
po,
good.
sir.
May question pa po ba sa rules of oblique ng inyong chest radiography?
None,
None,
sir.
sir.
None. Okay, let's move on. Okay, guys, kabaliktaran to ng PA oblique projection, RAO position, LAO position. Okay? For this position, ganun din. 45 degrees body rotation. Ang central ray mo, directed perpendicularly saan? Level ng inyong 7th thoracic vertebrae. Okay? Now, kung sa RPO, LPO, sa AP oblique projection kanina, ang side of interest na closer to the IR ang demonstrated, kabaliktaran to ng RAO, LAO. Guys, we're in. The side of interest is generally the side farther from the IR. Ulitin ko, farther from the IR. Kapag rawlaw ang posisyon, rawlaw, ang interest natin ay, the anatomy of interest ay yung mas malayo sa inyong image receptor. Ibig sabihin, okay? Ibig sabihin, kapag RAO position ang ginamit ko sa chest, ano ang demonstrated? Is it right or left? Pa-unmute po ako.
Left, sir. Po.
Left. Bakit?
Left.
Sa RAO po kasi, ang malapit sa image receptor is right. Eh ang sabi sa PA oblique projection ng chest, kung anong malayo, yun ang demonstrated. So kung naka-RAO ako, left ang malayo, left ang demonstrated. Kapag naka-left anterior oblique position ako, LAO position, okay? Ano ang demonstrated? Is it right? Right or left?
Right, sir. Right.
Right or left?
Right.
Right, sir.
Right side. Since sa LAO position, left ang malapit sa IR, right ang malayo, at ang rule natin sa rawlaw position ng inyong chest radiography, kung anong malayo, yun ang demonstrated. Okay, naintindihan po ba?
Yes, sir.
Yes, sir.
Yes po.
May nalilito pa po ba sa rules of oblique ng chest radiography?
None, sir.
None. Okay, very good. Okay, just to summarize, kapag RPO position, it is an AP oblique projection. Ang demonstrated dito is yung malapit sa IR. So, right lang field ang demonstrated na closer to the IR. Tandaan na, Right. RPO, ano ang malapit? Right. Okay? Sa LPO naman, since left ang malapit sa IR, AP oblique projection, ang demonstrated dito is the side closer to the IR, which means kung LPO, left lang ang demonstrated, which is closer to the IR. Naintindihan po ba?
Yes po.
Okay. Kabaliktaran to guys ha. Kabaliktaran to ng raw-law position. Kapag RAO position, ang rule natin sa raw-law, kung ano ang malayo, yun ang demonstrated. So, kung naka-RAO position ka, nakadikit ang right side sa inyong IR, ano ang malayo?
Left.
Right or left?
Left.
Ibig sabihin, left lang ang demonstrated, which is farther from your IR. Kapag LAO position naman, LAO position, sabi natin, kung ano ang malayo sa LAO, yun ang demonstrated. Since sa LAO position, left ang nakadikit sa IR, ano ang demonstrated? Yung malayo, which is your right lang na malayo or farther from your IR. Naintindihan na ho ba?
Yes, sir.
May nalilito pa po ba?
Very well.
None, sir.
None. Okay. Very good. Okay. Let's proceed to your ribs X-ray. Okay. Your ribs X-ray is a radiographic examination of your thoracic cage wherein it uses a small amount of radiation or ionizing radiation to produce a radiograph that uses to examine and assess the anterior and posterior ribs of the patient. This is also used as an oblique images in the context of trauma, unlike a standard chest radiograph. This examination applies a lower kV, higher MES technique to highlight the bony structure. So in comparison sa chest radiography, okay, mas gumagamit tayo dito ng mas mataas na radiation, specifically higher MAS for us to visualize the bones of your ribs. Okay, it often involves two projections. Okay, one supradiaphragmatic ribs and two of the subdiaphragmatic ribs. Okay, mamaya explain ko later on yan. Okay, let's start with your AP projection and PA projection. But then, gaya na sabi ko, since rules of oblique ang gusto kong i-emphasize sa lecture na to, doon tayo magpo-focus later on. Let's start. For your frontal projections of your ribs, meron tayong PA projection tsaka AP projection. Tandaan, na kapag, depende yan, in the context of trauma guys, okay? Depende yan sa kung ano ang tumama or kung saan yung suspected injury. So kung halimbawa nakipagsuntukan ako, tinamaan ako sa harap, nagko-complain ako sa right side of my chest, traumatic injury. Okay? So ano ang interest, ano ang examination ang preferred ko for this kind of situation? Since nasa harap ang problema ko, gagamit ako ng PA projection. Sir, bakit PA projection? Paano ho ba natin pinoposisyon ng PA projection? Ang PA projection, kailangan nakatalikod ang pasyente sa inyong tubo. Okay? Malapit ang anterior aspect sa inyong plaka. Okay? By doing this position, inilalapit mo yung anatomy of interest sa inyong image receptor, which will provide a greater detail for your radiograph. Ibig sabihin, kapag PA projection ang ginamit natin, it best demonstrate the anterior ribs above the diaphragm. Anterior ribs above the diaphragm. Ulitin ko ha, PA projection will demonstrate the anterior ribs above the diaphragm. Now, sa AP projection naman, for example, okay, sinuntok ako sa likod naman, nagko-complain ako ng masakit sa likuran ko. The routine of choice for this kind of condition is AP projection, wherein nakaharap ako sa tubo, yung likod ko nakadikit sa IR, and remember that AP projection best demonstrate what? Posterior ribs naman, above or below the diaphragm. Above or below the diaphragm. Okay? Now, sir, paano ko malalaman kung anterior ribs or posterior ribs na ang nakikita ko sa image? Ganito ay tsura dyan. Remember that your posterior ribs ang pag-uusapan natin ha, will slopes downward from the medial aspect. Ibig sabihin, mag-move siya or mag-slope siya downward from your medial aspect. From the medial aspect ha. Kapag sinabi namang anterior ribs, it will slopes downward from the lateral aspect. This one. Okay, from the what? Lateral aspect, it will slopes downward towards the midline. Kapag posterior ribs naman, mula sa midpoint of your vertebrae, mag-slopes down siya laterally. And that is your posterior ribs. Okay? Okay. Kapag PA projection, ano ang instruction natin? It's your full inspiration and the patient must be positioned in an upright position. Bihira ka naman makakita ng patient na naka-prone kapag PA projection ng inyong ribs. Imaginein mo, kay may injury ang pasyente sa ribs, harap, anterior ribs. Tapos, padadapain mo, dadaganin niya, no way. Hindi pwede yon. So, kailangan naka-upright position ang pasyente when you use a PA projection. And you also uses a full inspiration breathing instruction for us to demonstrate the anterior ribs above the diaphragm. Kapag pinahinga mo kasi ng malalim ang pasyente, anong nangyayari? Nade-depress ang diaphragm. Ibig sabihin, kapag nade-depress ang diaphragm, mas nakakakita ka ng mas madaming anterior ribs. Kapag umangat ho kasi yan, yung ibang anterior ribs, hindi mo makikita. Okay? So, kailan lang ba umaangat yung diaphragm? Kapag pinalabas mo yung hangin or pina-exhale mo ang pasyente. Sa AP projection naman, it's either full inspiration or full expiration, either upright or supine position. Sir, bakit magkaiba? Tandaan na, posterior ribs ang pinag-uusapan natin dito. Okay, sir, bakit upright position? Upright position ang ginagamit natin kung ribs above the diaphragm. Kapag supine naman ang pinag-uusapan natin, ribs below the diaphragm. Okay? Now, kapag naka-upright ang pasyente, ano sabi ko kanina? Ribs above the diaphragm. So, ano ang instruction na ibibigay mo sa pasyente? It's your full inspiration. Full inspiration kapag naka-upright. Okay. Now, paano naman kapag nakasupine ang pasyente? Okay? Kapag nakasupine ang pasyente, ano ang interest natin? Ribs below the diaphragm. So for us to demonstrate ribs below the diaphragm, kailangan umangat ang inyong diaphragm. So for us to project the diaphragm, okay, or to move the diaphragm superiorly, you will ask the patient to do a full expiration or full exhalation. Ganito ang itsura niyan ha, sa PA projection, anterior ribs. Erase all muna tayo. Okay. Sa AP projection. Kapag AP projection, gaya ng sabi ko, upright position. In color. Upright position. Okay, this one. Okay, ano ang instruction? Full inspiration para ma-depress ang diaphragm. Pag na-depress ang diaphragm, mas makakakita ka ng posterior ribs above the diaphragm. Now, papaano naman ngayon kung ribs beneath the diaphragm? Kapag ribs beneath the diaphragm, kahit na nakakatayo ang pasyente, mas maganda kung supine ang gagamitin. Okay? Kapag nakasupine ang pasyente, just like this one, okay, hindi makakatulong ang gravity na hatakin ang diaphragm pababa. So, mas mapapakita mo ang posterior ribs below the diaphragm. Ang instruction mo lagi dito is full expiration para umangat ang diaphragm or full exhalation. Okay? Naintindihan po ba?
Yes, sir.
Yes.
Nakakasunod po ba, Radtech?
Yes, sir.
Okay, let's move on. So, ito ang focus ko ha. Projection versus position ulit ng inyong ribs x-ray naman. Ulitin ko lang para habang inuulit-ulit natin, mas maaalala ninyo. Gaya ng sabi ko, kapag AP oblique projection, anong position to? RPO, LPO. Kapag PA oblique projection, raw-law ang pinag-uusapan natin dyan. Raw-law. Raw-law. Okay, let's start with the AP oblique projection ng inyong ribs, guys. Okay? Sa inyong AP oblique projection ng ribs, okay, dali ha, palitan ko lang. The patient will be rotated 45 degrees. 45 degrees. Guys, ang dinedemonstrate natin sa oblique projection ng inyong ribs is what? Axillary ribs or lateral injury. Okay? Lateral injury. Pero depende to kung posterolateral injury or anterolateral injury. Magkaiba ang demonstrate for each procedure. Now, unahin natin si AP oblique projection. Okay? RPO, LPO. For this position, 45 degrees ang rotation. Places the affected side closest to the IR. Affected side closest to the IR. Now, for this position, guys, ano ang demonstrated? Tandaan, kapag RPO, LPO, you are trying to demonstrate posterolateral injury. Ulitin ko ha, when you position the patient in an RPO position, LPO position, you are trying to demonstrate a posterolateral injury. So kung posterolateral, more onto the side, more onto the posterior aspect ang injury ng pasyente, wag na wag mong gagawan ng rawlaw. Kailangan ang position mo is RPO position, LPO position. Now, for this kind of examination, the posterolateral injury is demonstrated in a way that the affected site is closest to the IR. Posterolateral injury demonstrated closer to the IR. Meaning, kung RPO position ang gagamitin ko, ano ang demonstrated? Posterolateral ng right or left?
Right, sir.
Right or left?
Right.
Ulitin ko,
Right,
ha?
sir.
Right.
RPO position, ano ang demonstrated? Posterolateral ng right or left?
Right.
Left.
Right side. Okay, very good.
Right.
Kapag LPO position naman, gaya na sabi ko, closest to the IR and demonstrated, you will demonstrate posterolateral injury closest to the IR. Posterolateral of injury ng right or left? LPO.
Left.
Left, sir.
Left side. Very good. Okay, very good. Now, sa PA oblique projection naman, raw position. Okay, same lang to, 45 degrees ang rotation. Place the affected side away from the IR. Away from the IR. Baliktad to ha, baliktad. Okay, ganito ang tsura yan. For example, this is your RAO position. The image shows an RAO position. This kind of examination is very useful when one is trying to demonstrate what? An anterolateral injury. Okay? So ang rule natin, kapag more onto the anterior lateral ang injury ng pasyente, hindi ka pwedeng gumamit ng RPO, LPO. Ang gagamitin mo lagi is raw-law position. RAO, LAO position. Now, this kind of examination is very unique in a way na dinedemonstrate niya ang anterolateral injury away from the IR. Hindi mo siya mai-demonstrate na closer to the IR ha. Ang anterolateral injury, hindi mo siya mai-demonstrate na malapit siya sa IR. Nade-demonstrate mo lagi ito in a way na ang affected site is away from the IR. Meaning, kapag RAO position, you are trying to demonstrate an anterolateral injury, right or left? RAO.
Left, sir.
Left. Kasi right is malapit, left is malayo. Eh ang sabi natin, anterolateral injury. Affected site away from the IR. So ang demonstrated sa RAO is left. Kabaliktaran niya ng LAO. Kapag nag-LAO position ka, guys, ang demonstrated dito is the right side, which is away from your image receptor. Naintindihan po ba?
Yes po.
Yes, sir.
Naintindihan po ba?
Yes,
Okay.
sir.
Yes, sir.
Very good, top rankers. Okay, just to summarize, tandaan ha, anterior ribs, kapag anterior ribs ang affected side, you will do a PA projection. Kapag posterior ribs, anong projection? AP projection. Okay. Affected side, kapag ribs above the diaphragm, ano ang position and respiration? Kapag ribs above the diaphragm, upright. Kapag ribs below the diaphragm, recumbent. And you will do a exhalation or expiration breathing instruction. Lastly, kapag posterolateral injury, ang gagamitin mo laging position is RPO, LPO. Tandaan ha, kapag posterolateral injury, hindi ka pwedeng gumamit ng raw-law. Okay? RPO, LPO position yan, wherein you are trying to demonstrate
Posterolateral injury, affected side down, closest to the IR. Okay? Kapag anterolateral injury naman, anterolateral injury, ang gagamitin mo lagi ay ay RAW, RAO, wherein you're trying to demonstrate the affected side away from the IR. Naintindihan mo ba, Radtech?
Yes, sir.
May nalilito pa po ba?
Yes, sir.
May
Okay
nalilito
na,
pa po ba?
sir.
Okay, very good. Sige, let's go to your spine radiography. Your spine radiography is utilized in both trauma and general imaging. Okay, spine radiography explores the cervical, thoracic, lumbar, and sacral regions. In more specialized departments, full-length spine radiography via projectional is still frequently utilized in the diagnosis and management of scoliosis. So in some institution, meron pa rin pong gumagawa ng full-length spine radiography. One of this institution is NKTI, kung saan ako nagtatrabaho. Gumagawa po kami kung tawagin ay stitching radiography, wherein kaya naming mag-provide ng isang image ng whole spine from cervical to sacral region in one film. Okay? This type of examination is very useful, especially for those patient na merong scoliosis. Okay? The shape and structure of each of the bones and articulations or joints of the vertebral column must be identified and demonstrated on radiographs. Can help doctors find out what causes patient back or neck pain. Okay. This type of examination is most commonly used to demonstrate ano-anong klaseng situation: scoliosis, kyphosis, lordosis. Ano pa? The context of trauma, spondylolisthesis, spondylolysis, ano pa ba? Transitional rib. Later on, i-explain ko yun. So these are the examinations routine examinations na ginagawa most commonly sa mga institution. So gaya ng sabi ko, since rules of oblique ang focus ko sa examination na to, okay, pahapyawan ko lang yung ibang examination. Okay? Let's start. Ready na po ba kayo?
Yes, sir.
Yes, sir. Okay, let's start with your cervical X-ray, guys.
Yes, sir.
Okay. Tandaan, guys, kapag traumatic injury, ano ang unang examination na gagawin natin? Cervical. Is it your AP? Is it your open mouth? Or is it your lateral projection? Ano ang sagot?
Lateral. Lateral.
Lateral? Sure na po ba? Sure na ho ba?
Lateral, sir.
Yes, sir. 50-50, sir.
Lateral,
Okay.
sir.
Actually, tama kayo lahat. Tama kayo lahat. Ang unang routine dapat na kukuhanan ninyo is lateral. Sir, bakit? Sir, bakit? Okay? Kapag lateral kasi, ang inuna ninyo, you are trying to rule out a possible subluxation or dislocation of your cervical spine. Now, sir, bakit hindi pwedeng unahin ang open mouth or ang inyong AP axial? Tandaan, sa AP axial projection, you are trying to ask the patient to chin up. Hindi pwede yon. Paano kung merong subluxation? Okay? So, out ka na sa AP projection. Paano nga, sir, pwede ba ang open mouth? No pa rin. Pangangangayin mo ang pasyente? No. As much as possible, you are trying to lessen the movement for those patients in the context of trauma. So, lateral projection. Sir, kapag nag-lateral, gagalaw pa rin naman ang pasyente. So, pwede ho ba akong kumuha ng lateral projection na hindi ko halos igagalaw ang pasyente? Yes, pwede. Paano? Cross-table lateral. Cross-table lateral approach. Okay, na nakahiga ang pasyente, nakatayo ang IR and horizontal ang beam. This way, kung mabe-verify mo na walang subluxation or dislocation ang pasyente sa lateral image, pwede ka nang mag-proceed saan? AP axial projection tsaka sa open mouth, lalo-lalo na rin sa oblique projection. Tandaan ha, hindi ka pwedeng mag-oblique, hindi ka pwedeng mag-AP axial, hindi ka pwedeng mag-open mouth kapag meron kang dislocation na kitang-kita sa inyong lateral image. Naintindihan mo ba?
Yes, sir. Yes, sir.
Yes, sir. C1 to C2.
Okay, very good. Okay, sa cervical X-ray, Tandaan, sa lateral x-ray ng inyong cervical, ano ang pinaka-primary of interest dito na madalas itanong sa board exam? Kung ano ang anatomy ang kita, which is your what? Zyga, apophyseal joint. Tandaan ha. Okay, tandaan. Kasama to sa rules of public mamaya. Kapag lateral ng cervical ang demonstrated ay zyga, apophyseal joint. Nakakasunod po ba? Nakakasunod po ba?
Yes, sir.
Yes, sir. Okay, let's proceed. Okay, sir, paano po ba nabubuo ang zygoapophyseal joint? For example, this is your two cervicals, guys. Okay? Now, nabubuo ang zygoapophyseal joint by the union of your inferior articular process, which is this one, and your superior articular process. Asan yung superior articular process? Ito ang superior articular process. Now, kapag nagpatong ang dalawang cervical spine, okay, at nagdidikit ang dalawang articular processes na nakakabuo ng zygoapophyseal joint. Okay? Nakakasunod po ba? At ang magpapakita ng zygoapophyseal joint sa inyong cervical x-ray ay lateral projection. Lateral projection. Okay, sa AP axial projection, ang ginagamit natin central ray angulation dito. Guys, axial. Ibig sabihin, gumamit ka ng more than 10 degrees central ray angulation, specifically 15 to 20 degrees. 15 to 20 degrees. Okay? Now, sir, bakit kailangan kong gumamit ng 15 to 20 degrees? Hindi ba pwedeng gumamit ako ng perpendicular central ray angulation? Actually, pwede naman. Kaya lang, hindi yan theoretical. Bakit? Sir, sa theory po kasi, hindi po pwede ang perpendicular kasi nagko-close po ang inyong intervertebral disc. Okay? Tandaan, asan ang intervertebral disc? Ito. Okay? In a lateral orientation ng inyong spine, tingnan nyo, oh, nakaslant siya pababa. Okay? So kung gagamit ka ng perpendicular central ray angulation, ang mangyayari dito, okay, nagko-close ang intervertebral disc space. So for us to provide ang image na merong open intervertebral disc space, kailangan mong gumamit ng central ray angulation na in a way na mag-a-align ang central ray beam sa slanting or inferior slanting ng inyong intervertebral disc. Okay? Intervertebral disc. So AP projection, kailangan 15 to 20 degrees cephalad. Sir, para saan ba tong AP projection? Okay? This is also very useful in the context of trauma. Plus, isa to sa nagpapademonstrate ng transitional rib kung tawagin. When you say transitional rib, guys, saan ho ba naka-attach ang inyong ribs? Hindi po ba ito ay naka-attach sa T1 to T12? First thoracic up to 12th thoracic spine. Now, there are some instances na meron kang tinatawag na transitional rib. Ibig sabihin, ang first rib mo, nakakabit siya sa C7. Imbis na sa T1 siya nakakabit or first thoracic, nakakabit siya sa C7. First rib yun, tinatawag siyang transitional rib. There are also some instances na meron kang transitional rib sa baba. Wherein the 12th thoracic, wherein the 12th rib ay nakakabit, imbis na sa 12th thoracic spine, nakakabit siya saan? L1 or first lumbar spine. Transitional rib kung tawagin yan. Okay? So mapapakita mo lang siya in a frontal projection. Okay. Open mouth projection. Tatandaan guys, ang Radtech hindi lang magaling sa dilim. Hindi lang magaling sa positioning. Hindi lang magaling magpatanggal ng bra. Magaling pa yan magpanganga ng pasyente. Tama ba guys? Tama po ba, Radtech?
Yes, sir.
Yes, sir. Yes, sir. Ang galing magpanganga ng Radtech. Okay? Ang galing na sa dilim, ang galing na magposisyon, ang galing magpatanggal ng bra, ang galing pang magpanganga. Okay, moving on.
All.
Sana all. Okay. Sa open mouth projection, guys, open mouth view ng inyong cervical spine. Okay? We're trying to demonstrate the dens without superimposition. There are some instances, guys, na tinatanong sa board exam kung bakit, anong nangyari at nagpo-provide ka ng dents na merong superimposition either occipital bone or upper incisor ng inyong pasyente. Upper incisor hindi lower incisor. Okay, now, halimbawa, ang dents ng pasyente nag-superimpose sa occipital bone. Ano ang error? Maybe, ang pasyente ninyo ay over neck extension. Sumobra sa tingala. That's why, nakapagpakita ka ng superimposition ng dents sa inyong occipital bone. Paano naman ngayon na kung nakapagpakita ka ng superimposition ng upper incisor sa inyong dents or odontoid process? Ibig sabihin na kayo ko masyado ang pasyente. Okay? Okay, let's proceed to your oblique. Okay, ito na yung roots of oblique natin. AP axial oblique projection, PA axial oblique projection. Guys, gumamit tayo ng term na axial Bakit? Dahil po ito sa gumamit tayo ng greater than 10 degrees central ray angulation. Okay, sir, bakit? Later on, i-explain ko. Tandaan, sa oblique projection, guys, ano ang pinapakita natin? Oblique ng cervical. Is it your zygapophyseal joint or your intervertebral foramina?
Intervertebral foramina.
Intervertebral foramina. It's your IVF. Okay. Remember sa lateral ng cervical, it's your ZJ. Sa oblique ng inyong cervical, it's your IVF. IVF. Explain ko muna. Okay. Kapag AP axial projection, AP axial oblique projection, you will position the patient RPO or LPO position. The patient is in supine or upright position. Gagamit ka ng 45 degrees body rotation at ang reference point po ay C4. Now, ang central ray na gagamitin for this kind of examination is this one. 15 to 20 degrees cephalad angulation. Sir, bakit? Tandaan, ang intervertebral foramina natin is situated yan. Lega, pinag-uusapan ko dito ang intervertebral foramina, stop share ko muna. Guys, tingin sa akin, eyes on me. Ang intervertebral foramina ng inyong cervical spine, okay? It is positioned in a very unique way. Bakit? The intervertebral foramina of your cervical spine is situated. This is your MSP, situated yan 45 degrees from your MSP. That's why gumagamit tayo ng 45 degrees body rotation para mas makita ninyo ang intervertebral foramina. Sir, bakit hindi pwedeng perpendicular central ray angulation? Ang IVF po ng inyong cervical is situated bukod sa 45 degrees from your MSP, naka-incline yan inferiorly. Okay, 15 to 20 degrees. Kaya bukod sa 45 degrees rotation, kailangan mong gumamit ng 15 degrees cephalad angulation para pumasok ang central ray sa inyong intervertebral foramina. Nakakasunod po ba? Top rankers, nakakasunod po ba?
Yes, sir.
Yes, sir. Okay. Guys, ang tanong, papasa ka na ba?
Papasa, sir.
Papasa. Magta-top ka na ba?
Magta-top.
Top.
Radtech all over the Philippines. What is your goal?
To top the board exam.
Okay.
Feeling, sir.
With feelings. Okay, of course. Okay, moving on. Okay, ito na yung sinasabi ko. Okay? Nag-oblique ka ng 45 degrees. Oo. Kaya lang gumamit siya ng perpendicular central ray angulation. Ang nangyari, hindi mo masyado nakita ang intervertebral foramina. Itong mga butas na to. So para ma-provide mo ang intervertebral foramina na mas open, kailangan mo ngayon gumamit ng 15 to 20 degrees separate angulation which will demonstrate, ayan, open na open ang inyong intervertebral foramina. Okay? Naiintindihan mo ba?
Yes, sir.
Yes, sir. Okay. Moving on. Guys, ito ang twist dyan. Kapag RPO, LPO position ang ginamit natin, you will demonstrate the IVF and pedicles farthest from the IR. So, ibig sabihin, kung RPO position, ang sabi natin, RPO position, ang demonstrated ay IVF or intervertebral foramina farthest from the IR. RPO position, anong demonstrate? Right or left?
Left.
Left side. Kasi ang sabi, Farthest from your IR. Kapag LPO naman, ano ang demonstrated?
Right.
Right side, which is
Right
farthest
side.
from your IR. Okay. Kabaliktaran to guys ng P-axial oblique projection. Okay? Sir, paano siya nagkabaliktad? Okay? Bukod sa 45 degrees ang rotation nyo, C4 din ang reference point, baliktad ang central ray angulation neto. Okay? Kung kanina sa RPO, LPO, 15 to 20 degrees cephalad, kapag raw-law position, 15 degrees caudal naman. 15 degrees caudal. For this position, you will demonstrate IVF pa rin, kaya lang closest to the IR. Closest to the IR. Nakakasunod po ba, top rankers? Nakakasunod po ba, top rankers? So, ibig sabihin, RAO position, cervical, ano demonstrated? Far or close?
Close.
Close.
Closest to the IR.
Closest to the IR. RAO position, right or left?
Right.
Right or left?
Sir.
Right. Kapag
Right,
LAO
sir.
position, right,
Left.
right or left?
Left.
Left. Very good. Very, very good. Okay, nakakasunod. Okay, just a review. Exit. Okay, for a while ha. Okay, nakikita po yung PowerPoint ko?
Yes, sir. Yes, sir.
Okay,
Yes, sir.
summary. Okay, sa lateral projection, identify natin, ZJ or IVF ang demonstrated. Okay, sa lateral, is it ZJ or IVF?
ZJ.
ZJ. Okay, very good. Of course, your zygoapophyseal joint. Okay, kapag oblique projection, ano demonstrated? ZJ or IVF?
IVF.
IVF. Oh, sa RPO, LPO, raw-law, parehas IVF. Kaya lang, it will be demonstrated in a different manner. Okay? Kapag RPO, LPO, is it far or close?
Far.
Far. Very good. Kapag raw-law position, is it far or close?
Close.
Okay, very good. Close. Okay, close. Ibig sabihin, yung mas malapit ang demonstrated. So, okay, explain ko kung bakit ha. Tingin sa illustration. Gaya ng sabi ko kanina, ang zygoapophyseal joint guys, from your mid-sagittal plane, situated yan ng 90 degrees. Zygoapophyseal joint ha, 90 degrees from your mid-sagittal point. So, para ma-demonstrate ang zygoapophyseal joint, tingin dito sa nirorotate ko, kailangan mo i-position ng pasyente, lateral projection para makita ninyo ang zygoapophyseal joint. Nakakasunod ba?
Yes,
Nakakasunod
sir.
ba? So for you to demonstrate intervertebral foramina, for example, RPO, LPO, unahin ko ang RPO. Okay. Ito ang dalawang butas ha. Tingin sa cursor. Okay? Ayan. Halimbawa, nag-RPO position ako. Ano ang demonstrated? IVF, ZJ.
IVF, sir.
It's your intervertebral foramina. Kaya lang,
IVF, sir.
ano ang demonstrated dito? Is it the far side or close side?
Far.
Far, sir.
Far. So ito ang close, ito ang far. Tingnan nyo mabuti. For this kind of position, ang napapakita ay yung mas malayo sa IR, which is the far side. Nakakasunod po ba?
Yes, sir.
Yes, sir.
Very good.
Bring
very
it on,
good.
sir.
Bring it on. Okay, very good. Okay? So balik na rin naman natin. For example, gawin kong raw-law. Raw-law. Okay, for example, puposition ko siya in an RAO position. This one. Ganyan na position ng RAO position. Tama? Tama
Yes,
po
sir.
ba?
Yes,
Okay.
po, sir.
Kung gagamit ako ng perpendicular central ray angulation, perpendicular central ray angulation, okay? Ano ang madedemonstrate ko? Close or far? Close or far?
Close.
Side. Close side. So, ibig sabihin kapag
Close, sir.
RAO, right side. LAO, left side. Which will demonstrate the close aspect of your intervertebral foramina. Nakakasunod po ba, top rankers?
Yes, sir.
Yes, sir.
Kasunod po ba? Sigurado?
Definitely,
Yes, sir.
sir.
Definitely. Okay, sige. Moving on. Let's go to your thoracic x-ray. So thoracic x-ray, we do have your AP and lateral. Kadalasan. Kadalasan. Okay? Sa AP projection, guys, okay, you will demonstrate your 12 thoracic spine from your T1 to T12, and it is very useful to demonstrate the intervertebral disc, the vertebral body of the patient. Sa lateral projection naman, ganun din. Kaya lang, isa sa pinapakita ng lateral projection is what? Anong structure? Is it your ZJ or IVF?
IVF.
ZJ or IVF?
IVF, sir.
IVF. Tandaan, guys, kabaliktaran to ng cervical kanina, ha. Kung sa lateral ng cervical, guys, ang napapakita ninyo is ZJ or zygoapophyseal joint. Sa thoracic spine, hindi. Ang napapakita mo sa lateral is intervertebral foramina. Etong mga butas na to. Intervertebral foramina. Okay? Nakuha po ba? Intervertebral foramina. Lateral, intervertebral foramina. So, kung IVF na ang napapakita ko sa lateral thoracic, ibig sabihin sa oblique ng thoracic, ang mapapakita ko ay ano mapapakita ko? Zygoapophyseal joint. Guys, very good. Okay, so let's proceed. Okay, sa zygoapophyseal joint, guys, ng inyong cervical, tatandaan ninyo na the zygoapophyseal joint is situated anteriorly, okay, wherein the zygoapophyseal joint is what? Okay, it is situated 70 degrees from your IR, 20 degrees from your MSP. Okay, now, sa AP oblique projection, guys, RPO, LPO position, the patient must be positioned in a lateral or upright supine position. Sir, bakit magkaiba? Ang pinakamadaling way is to position the patient in a lateral position. Kapag nag-lateral position ka, just rotate the body 20 degrees posteriorly, katulad nito. Okay? Sir, paano naman ngayon kung nakahiga ang pasyente or naka-upright ang pasyente? Pwede naman. Kaya lang, for you to project the zygoapophyseal joint of your thoracic spine, you must ask the patient to rotate the body 70 degrees anteriorly naman. Anteriorly from supine position. Okay? This way, you could place the mid-coronal plane of the body 70 degrees in relation to your image receptor. With the perpendicular central ray angulation directed to the 7th thoracic spine, okay, you could demonstrate what? The zygoapophyseal joint of your thoracic spine. Sir, in what manner ko siya madademonstrate? Kapag RPO, LPO position ang ginamit natin, guys, madademonstrate mo ang zygoapophyseal joint farthest from your IR. Farthest from your IR. Okay? So, ibig sabihin, kung RPO position ang gagamitin ko, ano demonstrated? Malayo, malapit?
Malayo.
Malayo. So, ibig sabihin, kung naka-RPO position ako, ano demonstrated? Kanan, kaliwa?
Left,
kaliwa.
Left
Right
side.
or left?
left,
Right or left?
left, sir.
Left side. Very good. Kasi left ang malayo sa IR. Kung mag-LPO ako, ano demonstrated? Right or
The
left?
right side.
Right side.
Right side. Very, very good. Okay, right side, guys. Very good. Okay, guys. Kabaliktaran to ng PA oblique projection, row-low position for your thoracic spine. Okay? Now, kapag naka-lateral position tayo, you must rotate the body 20 degrees anteriorly. Kapag naka-prone or upright naman, body rotated 70 degrees posteriorly. This will also place your mid-sagittal plane or mid-coronal plane 70 degrees in relation to your image receptor. Okay? Now, kung sa RPO, LPO, nakakapag-demonstrate ka ng zygoapophyseal joint na malayo sa IR, dito sa row-low position, guys, you could demonstrate the ZJ or zygoapophyseal joint closest to the IR. Closest to the IR. Ibig sabihin, kung nag-RAO position ako, ano demonstrated? Right or left?
Right.
Right or left?
Right.
Right side. Kasi right ang malapit sa IR eh. Ang sabi sa rule natin, RAO position, LAO position, demonstrate ZJ closest to the IR. So kung RAO position, RAO position, right side ang demonstrated. Kapag LAO position, ano demonstrated?
Left.
Left side. Left
Left.
side. Very good. Okay. Summarization ulit tayo. Okay. Share screen. Okay, kita screen ko ha? Kita po screen ko, guys?
Yes, sir.
Yes, sir.
Okay. Sa lateral projection, guys, ano demonstrated nga natin? Is it ZJ or IVF?
IVF, sir.
IVF.
IVF, sigurado?
Yes.
Yes, sir.
Kung IVF na sa lateral, obviously, sa oblique natin, is your zygoofficial joint. Zygoofficial joint, tama?
Yes, sir.
Kaya lang, this will be demonstrated in a different manner. Okay, sir, paano different? Kapag RPO, LPO, is it far or close?
Far.
Close. It's far, guys. Kapag ZJ po ng Raulaw, is it far or close?
Close.
Sir, it's close, guys. Okay, very good. Now, i-explain ko mabuti. Okay, sir, bakit far or close? Ulitin ko ha. Ang zygoofficial joint ng inyong thoracic spine is situated anteriorly in a manner that it forms 15 to 20 degrees from your mid-coronal plane and 70 to 75 degrees from your mid-sagittal plane. That's why, kapag from your lateral projection, halimbawa, nakalateral ang pasyente, kung gusto kong mapakita ang zygoofficial joint, i-rotate ko siya sa RPO o LPO, i-rotate ko siya ng 20 degrees posteriorly para mapakita ko ang zygoofficial joint. Katulad nito. Ano napapakita ko dito? Is it far or close? This is the close side. This is the far side. Ano demonstrated sa RPO? Far or close? It's the zygoofficial joint far from your IR. Okay? Now, baliktarin ko ngayon ha. Baliktarin ko. Okay. Paano naman ngayon kung Raulaw position? Okay. For example, this is your LAO position. Okay. Ayan ha. Naka-LAO ang pasyente. Sulat ako ng pen. This is the near side or the close side. This is the far side. Okay. Gagamit ako ng perpendicular central ray angulation. Ano ang mapapakita ko? Is it the zygoofficial joint far from the IR or close to the IR?
Close, sir.
That is close.
Close to the IR. Very good. Close to the IR. So, ulitin ko ha. ZJ, sa oblique makikita. IVF sa lateral. Nakakasunod po ba, top rankers?
Yes, sir.
Yes, sir. Very good. Okay, moving on. Moving on. Sa lumbar x-ray naman tayo. Okay, lumbar x-ray. Sa lumbar x-ray naman tayo, we do have your AP projection. AP projection is usually done in a supine position, recumbent position. There are some instances na gumagamit ang pasyente ng upright position, pero case-to-case basis. Since board exam ang pinag-uusapan natin, theoretical, ginagamit to in a recumbent or supine position. Okay, now, when positioning the patient in an AP lumbar projection, okay, you must ask the patient to flex the hips and knees. Okay, flex the hips and knees. Sir, bakit kailangan mag-flex ng hips and knees? There are 4 reasons. First is to reduce the lumbar lordosis. Lumbar lordosis. Kapag nag-flex ka ng hips and knees, ang nangyayari, mas na-reduce mo ang lumbar lordosis. Bakit mo naman kailangan i-reduce ang lumbar lordosis? You have your 2 reasons. First is to place the back of in contact with the table. Kapag nag-reduce ka ng lumbar lordosis, mas tumidikit ang posterior aspect ng pasyente sa inyong image receptor. 1 factor yan. Third is reduces distortion of your vertebral bodies. Since mas malapit siya sa IR, kapag nabawasan na kapag close contact ka sa table, nababawasan ng distortion. Okay? This way, makakapagpakita ka ng better delineation of your intervertebral disc. Better delineation of your intervertebral disc. Okay, this one. Sa lateral projection naman, okay, the patient is positioned in a lateral recumbent. Okay, now, there are some instances na most of the case, perpendicular ang ginagamit natin. Kaya lang, there are some instances na gumagamit tayo ng caudal angulation, specifically 5 to 8 degrees. Sir, bakit 5 to 8 degrees? Kapag perpendicular, kapag ang spine ng pasyente or lumbar spine ng pasyente ay nag-parallel sa table ninyo. Okay, for example, this is a table and this is your lumbar spine. Okay? Kapag nag-parallel siya sa table, wala problema dyan. Gagamit ka ngayon ng perpendicular central ray angulation. Kaya lang, there are some instances, lalong-lalo na sa kababaihan, na kung ito ang table mo, hindi nagpa-parallel ang inyong lumbar spine. Okay? So in this case, gagamit ka ngayon ng caudal angulation. 5 degrees kung lalaki, 8 degrees kung babae. Bakit? Mas malaki po ang balakang ng kababaihan kumpara sa kalalakihan. Kaya mas malaki dapat ang angulation kapag mga babae. Okay? Now, your lateral projection, remember, kasama to sa rules of oblique, ginagamit to to demonstrate what? The intervertebral foramina. Asan ang intervertebral foramina? Ito po, itong mga kabutasan na to. Intervertebral foramina. Okay? Tandaan, hindi porket nagpapakita ka ng IVF sa lateral projection ng lumbar, ay kita na lahat. Guys, ang nakikita lang na intervertebral foramina sa lateral projection ng lumbar is from L1 to L4. Ang L5 to S1, intervertebral foramina, ay hindi nakikita sa lateral. Nakikita po ito sa PH shelf oblique projection, COVAX method. So, didiscuss natin yan sa intensive. Okay, for now, ang pina-point out lang natin dito is kung ano nakikita sa lateral, which is your IVF. Hindi zygapophyseal joint, ha? IVF, intervertebral foramina. Okay, your lateral projection is very useful in cases na spondylolisthesis kung tawagin, or wherein the bone in the lower back slips out of place. Ito yung mga cases na nagkakaroon ng slip disc ang pasyente. So, in medical term, tinatawag siyang spondylolisthesis. Tandaan, kapag merong slip disc ang pasyente, ang pinaka interest or pinaka routine examination na prefer na magpapakita ng spondylolisthesis is lateral projection. Okay? Lateral projection. Sir, ano pinagkaiba ng spondylolisthesis sa spondylolysis? Okay. Ang spondylolysis is a cases wherein the pars interarticularis of your lumbar vertebrae is fractured. Okay? In some cases, kapag naghihiwalay na ang pars interarticularis ng pasyente, doon siya nakakapag-cause ng slip disc. So, spondylolisthesis is pinalalang version ng spondylolysis wherein the lumbar spine is moves out of place, slips out of place. Okay? Spondylolysis, spondylolisthesis. Sir, paano ko mapapakita ang spondylolysis at paano ko mapapakita ang spondylolisthesis? Gaya ng sabi ko kanina, kapag spondylolisthesis ang pinag-uusapan natin or slip disc, lateral ang gagamitin mo. Kaya lang, kapag spondylolysis ang pinag-uusapan natin, ang magpapakita dyan ay oblique. Oblique. Sir, bakit oblique? Ano ba ang inaatake sa spondylolysis? It's your pars interarticularis. Nakikita ang pars interarticularis as part of your scatty dog sign na nakikita sa oblique. Scatty dog sign. Okay, for us to discuss these parts of your scatty dog sign. For us to discuss this scatty dog sign. Okay, these are the parts of your scatty dog sign. Umpisahan natin sa ilong. The nose of your scatty dog sign is your transverse process. The eye of your scatty dog sign is your pedicle. Now, ito yung
pedicle.
Yes. Ito ang interest natin sa spondylolysis, the neck. The neck of the scatty dog sign is your what? Pars interarticularis. Ito yung inaatake ng spondylolysis wherein kung halimbawa magkaroon ka ng fracture dito, okay? Positive ang pasyente for your spondylolysis. Now, the foot of the patient or the front foot of your scatty dog sign is the what? Inferior articular process. The ears of your scatty dog sign is your superior articular process. So para saan itong superior and inferior articular process? Kapag nagpatong ang dalawang spine, guys, okay? This is your superior articular process. This is your inferior articular process. Okay? Kapag nagpatong silang dalawa, nakakabuo ka ng isang joint. This one. And you will call it what? Zygoapophyseal joint. Ibig sabihin, kung sa lateral ng lumbar, it's your IVF. Sa oblique, nakakapagpakita ka ng zygoapophyseal joint. Okay? Sir, paano ba naman nabubuo ang intervertebral foramina ng inyong lumbar spine? Nabubuo yan with the formation or kapag nagpatong ang dalawang lumbar spine. Okay? For example, this one. This is your intervertebral foramina. Okay? Tama? Now, napipiyok na si sir. Okay. Now, paano siya nabubuo? For example, this is your upper vertebra. This is your lower vertebra. Okay? Now, your upper vertebra does have a inferior vertebral notch. Ang tawag dyan, inferior vertebral notch. Your lower vertebra, this one, does have what? Superior vertebral notch. Superior vertebral notch. Ito yan ha. Superior vertebral notch. So, kapag nagpatong ang upper vertebra sa lower vertebra, nakakabuo ka ng isang butas kasi nagjo-join yung inyong dalawang vertebral notch kung tawagin. With the union of these vertebral notches, nakakabuo ka ng isang foramina called your IVF, intervertebral foramina. Nakakasunod po ba, Radtech?
Yes, sir.
Kaya pa matuto?
Yes, sir. Bring it on.
Bring it on. Okay. Ang tanong, papasa ka na ba sa December?
Papasa, sir.
Pasa.
Magtatap ka na ba sa December?
Magtatap.
Magtatap.
Top rankers, Radtech all over the Philippines. What is your goal?
To top the board exam.
Top board exam. Okay, very good. Moving on. Let's go to the PA projection and AP oblique projection of your lumbar spine. Okay, AP oblique projection, RPO, LPO position. With the patient in semi-supine position, body rotated 45 degrees. Highlighter, 45 degrees ang rotation. Okay, you will use a perpendicular central ray angulation and it will demonstrate, gaya na sabi ko, scatidog sign which will demonstrate the zygoapophyseal joint. Zygoapophyseal joint. Now, kung RPO, LPO, and Rowlaw demonstrate zygoapophyseal joint in a different manner. Why? Sa RPO, LPO position, guys, you could demonstrate the zygoapophyseal joint closest to the IR. Closest to the IR. Ibig sabihin, guys, kabaliktaran to ng thoracic kanina ha. Ang thoracic natin kanina, nakakapagpakita siya sa RPO, LPO position, nakakapagpakita ka ng CJ malayo sa IR. Kabaliktaran yan ng lumbar. Okay? Lumbar. Bakit? Pinapakita niya ang zygoapophyseal joint closest to your image receptor sa RPO, LPO position. Ibig sabihin, kung naka-RPO position ako, ano ang demonstrated? Is it right or left?
Right, sir.
Right or left?
Right.
Right, sir.
Right. Kasi right ang malapit.
That is
Kapag
right.
kapag LPO, is it right or left?
Left.
Right or left?
Left.
Left,
Left
sir.
side. Very good. Okay. Now, punta naman tayo sa PA oblique projection, Rowlaw position. Sa Rowlaw position, ganun din, 45 degrees ang body rotation, okay? Perpendicular din ang central ray angulation. Kaya lang, ang zygoapophyseal joint for this kind of procedure is demonstrated in a different manner wherein the zygoapophyseal joint is demonstrated farthest from the IR. Ibig sabihin, kapag naka-Rowlaw ako, naka-Rowlaw or let's say RAO position, naka-RAO position ako, ano ang demonstrated? Is it right or left?
Left.
Right or left?
Left.
Ulitin ko nga. RAO position, right or left?
Left.
Left, sir.
It's your left side. Bakit? Sa RAO po, left ang malayo. Okay. LAO
Farthest.
position, right or left?
Right.
Right or left?
Right.
Right or left?
Right. Right side.
Left sa right side kasi yun ang malayo sa IR. Farthest from the IR. Zygoapophyseal joint. Okay. Review ulit tayo. Guys, natututo po ba?
Yes, sir.
Yes, sir.
Natututo po ba?
Yes, sir.
Okay.
Yes,
For
sir.
example. Okay. For example, ito ang image receptor ko. This is my lumbar spine. Okay. Kung sa thoracic kanina, guys, ano ang sabi ko kanina? Sa thoracic spine, ito ang thoracic spine ko ha. Ang thoracic spine, ang ZJ ng thoracic spine is situated anteriorly. Sa lumbar, baliktad yan. Ang zygapophyseal joint ng pasyente sa lumbar spine is situated posteriorly. Posteriorly. Okay? That's why kapag nag-o-oblique ang pasyente, okay? For example, RPO. Pak, naka-RPO ako. Ano ang demonstrated? Malayo, malapit. Ito ang malapit,
Malapit.
ha?
Malapit.
Ito ang malayo, ito ang malapit. Okay, ulitin ko. Nag-RPO position ako sa inyong lumbar spine. Okay? Ano ang demonstrated? Fire close.
Closer.
Far.
Fire close.
Closer.
To the IR.
Close.
Ala, may nalilito. Okay, RPO position, perpendicular central ray angulation. Okay, ito ang close, ito ang far. Ano demonstrated sa RPO? Far or close?
Far.
Closer.
Far or close?
Close.
Closer. Close.
Guys,
To the eye.
it's close to the IR. Okay, asan na yun? It's close to the IR. Ibig sabihin, okay, ZJ ha, ZJ. Kapag RPO, LPO, ang pinag-uusapan natin, etong malapit ang demonstrated. So, close na ito. Nakakasunod pa? Nakakasunod?
Yes, sir.
Yes, sir.
Okay, babaliktarin ko siya. Babaliktarin ko siya ha. Okay, gagamit ako ng RAO position. For example, RAO position. Pak, naka-RAO ako. Tama? Naka-RAO ako. Tama?
Yes, sir.
Okay, delete natin yung mga pens. Okay. Okay, this is the far ZJ, this is the close ZJ. Kung naka-RAO position ako, ano ang demonstrated? Far or close?
Far, sir.
Far. Ibig sabihin, kapag naka-RAO position ako, kaliwa kanan.
Left.
Side ang demonstrated. Kaliwa ang demonstrated. Okay? Sige. So, ibig sabihin, sa ZJ ng Raulaw, ano ang demonstrated? Far or close?
Far.
Far. Okay. Sa lateral, ano demonstrated? ZJ IVF.
Zygapophyseal joint, sir.
IVF.
IVF. Okay, very good. So that's the summary of the rules of oblique of your spine. Ulitin ko ha. Cervical spine, ZJ, IVF, cervical, ganito ang itsura ng rules of oblique ninyo. Natuto po ba, top rankers?
Yes, sir.
Yes, sir.
Natuto po ba?
Medyo nalito, sir.
Yes,
sir.
Nalito. Okay, sige.
Medyo
Testingin nga.
nalito.
Testingin nga natin ang napag-aralan natin for today. Okay. Testingin natin ha. Nakikita ho ba screen ko?
Yes, sir.
Yes, sir.
Okay, start tayo sa chest radiography. Sa AP oblique projection, RPO, LPO, ano demonstrated? Sasabihin nyo lang sa akin kung far or close. Chest, RPO, LPO, far or close?
Far.
Far or close?
Far, sir. Close po.
Far or close?
Close.
Raulaw, far or close?
Close.
Close.
Farther po.
Farther.
Raulaw, far or close?
Close.
Far po.
Nalilito guys, it's far. Guys, nalilito kayo ha? Far. Okay. Sa ribs naman, AP oblique projection, RPO, LPO. Okay, you are trying to demonstrate a posterolateral injury na malapit sa IR. Ang demonstrated dito ay far or close?
Close.
Close. Okay. Sa Raulaw naman, you are trying to demonstrate an anterolateral injury. Anterolateral injury. Pero it will be demonstrated na malayo sa IR. Okay, far or close?
Close. Far.
Far. Okay, baba tayo. Punta tayo punta tayo sa rules of oblique ng inyong cervical, thoracic, and lumbar. Okay. Sa lateral, is it ZJ or IVF?
DJ.
DJ, sir.
ZJ or IVF?
DJ,
Okay.
sir.
Okay. Sa oblique, ZJ or IVF?
IVF.
Okay, very good.
IVF.
IVF. Kaya lang, it will be demonstrated in a different manner. Okay, sa RPO, is it far or close?
Far.
Far, very good. Dito sa Raulaw, obviously, it's your close. Tama? Tama po ba?
Yes.
Okay, very good. Okay, sa thoracic naman, sa lateral, ano ang nakikita? Is it ZJ or IVF?
IVF.
Sigurado?
Yeah.
Kung 74.99% na lang ang rating mo sa board exam at ito ang magtatama sa inyo, isusugal nyo ba ang grade nyo? CJ or IVF?
Yes, sir.
Sir, IVF. Very good. IVF ang sagot dyan. Now, sa oblique, obviously, ang sagot dyan ay, ano nakikita sa thoracic? Oblique?
DJ.
Kaya lang, gaya na sabi ko, it will be demonstrated in a different manner. Okay. Is it far or close sa RPO, LPO?
Far.
Far or close?
Far.
Far, very good. Sa Raulaw naman, is it far or close?
Close.
Very good, very good, very good. Okay, sa lateral lumbar, is it ZJ or IVF?
IVF.
ZJ or IVF?
IVF.
Sigurado?
Yes.
74.99% sigurado?
Absolutely.
Sigurado. Kung IVF ang isasagot mo, kapatid, congratulations, magkakaroon ka na ng lisensya. Obviously, sa oblique natin, ano na sagot yan? It's your ZJ. Tama?
Yes, sir.
Kaya lang,
Yes,
it will
sir.
be demonstrated in a different manner. Now, kapag RPO, LPO, is it far or close?
Close.
Far or close?
Close.
Sigurado?
Yes,
Sigurado?
Yes, sir.
Okay, very good. Natututo.
Definitely yes, sir.
Okay, sa ZJ naman ng inyong Raulaw, is it far or close?
Far.
Far,
Yes, far.
very good. Guys, palakpakan nyo naman ang mga sarili nyo kasi after finishing this lecture, marunong na kayo sa rules of oblique. Tama po ba?
Yes, sir.
Yes,
sir.
Mamanina ang board exam, tama?
Yes, sir.
Yes,
Pagdating
sir.
ng board exam, pag naka-encounter ng rules of oblique, maning-manina sa inyo. Tama ba?
Tama, sir.
Yes,
Okay,
sir.
guys, ngayon pa lang, mag-top rank man kayo o hindi, pero definitely gustong-gusto ko mag-top rank kayo. Ngayon pa lang, kino-congratulate ko na kayo, lahat ng umattend ng lecture na to in completing this lecture. Okay? Sana kung ano man ang natutunan nyo for this afternoon ay magamit ninyo sa board exam neto 2021 December board exam licensure examination for those who will take the exam. Now, pinagdadasal ko at ngayon pa lang, wini-welcome ko na kayo sa profession ng Radiologic Technologists. Okay? Natuto po
Yes,
ba,
sir.
top rankers?
Yes, sir.
Tech all over the Philippines. Ang tanong, papasa ka na ba?
Yes, sir.
Papasa, magta-top ka na ba?
Magtatap.
Tatap. Radtech all over the Philippines. What is your goal?
To top the board exam.
Top board exam na mamaos-maos pa. Guys, that's all for me. Maraming salamat sa opportunity. And I hope may natutunan kayo sa akin. Good afternoon.
Thank you, sir.
Sir.
Thank you po.